Hello and welcome to the program. I am Oyi Adekunle. Today marks an important day for Africa. After decades of painstaking efforts, the continent has officially been declared polio-free by the Africa Regional Certification Commission, ARCC. 4 years ago, the last remaining strain of the virus was reported in Borno, northeast Nigeria. But now we can boldly say Nigeria has made huge success in eliminating the wild poliovirus without any case being identified since 2016. It took decades to get here, and all thanks to a coalition of international health bodies, national and local governments, as well as community volunteers. All right, so joining me now to discuss more on this is Anis Rahman Siddiq, who is the head of immunization for UNICEF Nigeria. Mr. Siddiq, thank you very much for joining us on the program. And first off, let me say congratulations to you. How exactly do you feel right now?
I think this is a momentous achievement, and I'm really very excited, like any other Nigerians. And specifically, today I remember all the vaccinators, thousands and millions of influencers who supported polio program. Some lost their life in this battle, and finally we won the battle against wild poliovirus. I feel overwhelmed.
Well, we do know that some conditions must have been met before we got here. Just take us back maybe a few years of how we got to this point.
The history of polio eradication in Nigeria, it started from 1995. And till for a decade, there is no improvement in terms of reducing the number of cases. Moreover, in 2003, there was a nationwide ban that some of the rumor popped up that poliovirus is not safe, while the campaign was stopped for a while. So it has been situation and ups and downs, but thanks for the Nigerian government who really took the lead, and the state governments, and the partnership with the traditional leaders. So they all understood the vaccine is safe and is actually saving the children. Just think about in 1996, almost 75,000 children were paralyzed in Africa. So now there is no polio case. There is no paralysis due to polio. So this has been a historic, pathway, and then the partnership, a seamless partnership with the northern traditional leaders, the government, and the international partners, some philanthropists, and the foundations such as Aliko Dangote Foundation, Bill Gates. They have been quite interested in the Nigeria program. And then there's a huge improvement while the vaccine was accepted by everyone. And we reached to the milestone of no polio case in 2015. And 2016, it was the second year. And we all thought that the polio probably is over. But in August, polio struck back in Borno State. And, that was another, situation. No one thought about it. It was a huge blow to the program. And the whole world was watching on us, what is happening in Nigeria. So those 4 polio cases were found in Borno State. And then thanks to the Nigerian army who actually liberated those areas where those polio cases were identified. So, and then we developed those partnership and last for 4 years, where we, from UNICEF side, we deployed 4,000 community volunteers, those who are working in the host community, in the IPD, and in the inaccessible areas, and providing support to the vaccinators. And also there was a very high-level strategy developed with Nigerian military called Reaching Every Settlement. So with the support of military and civil vaccination process, we were able to reach maximum number of children. And the wild polio virus in Borno state, which was transmitting there for a while, is gone. So from that time till today, it is 4 years, there is no polio case in Borno state. And for that is not only that, on the ground, the initiative, but also think about this satellite imagery, those satellite imagery giving us information where there's children available, where not, where is these settlements are there or not, and the geospatial strategies, vaccine tracking system, and ring fencing all the inaccessible area to allow vaccinator to vaccinate against wild polio virus. So all these yielded a good result where today we see an achievement.
So how important is this feat now for Nigeria and the entire African continent?
This is an important milestone. It's just not only that. If you look at for Africa in general, if you see, as I told you, that 75,000 children were paralyzed in 1996. So if you take that baseline, today you don't see any paralysis due to polio. So you see how many disability you reversed. And also we did not count the polio-related mortality. So we saved lives. So you see that has a direct impact to the economy. On the direct investment for polio now can be diverted to other public health initiatives like the other diseases this we see, and for example, the meningitis A or cholera or measles, those kind of disease can be addressed. And most importantly, the polio built that infrastructure, that the human resources, the data management system, the technology, those can be used for Nigeria's health system strengthening and developing the primary healthcare system. So I see this is a huge feat and huge achievement for Nigeria in terms of improving healthcare system and also improving the coverage.
And I also want to ask you, because now we've achieved this now, Nigeria, Africa declared polio free. It's okay. Some people may decide, okay, we're free and this has gone for good. So what I'm asking now is, can wild polio virus return?
The wild polio virus is gone, but there is some kind of environmental strains are there that mildly affect children. So we need to finish the job fully. So that's why we need to improve our routine immunization coverage. So polio vaccine is given through the routine immunization system. Like if a child, when is 6 weeks old, that child should be given OPV, and at the age of 10 weeks and at the age of 14 weeks, as well as the injectable IPV. So those vaccines are given during the routine system. And also to improve, if we improve the routine system, then other diseases are also addressed. Like, for example, the BCG and measles, the yellow fever, and many other vaccines are given through the routine system. So one of the important tasks for us to improve routine immunization, both on the supply and demand side. So, and there's a huge task ahead. Unfortunately, Nigeria is having very high number of unimmunized children. So we need to ensure those unimmunized children are immunized through the routine immunization system, and building that system that also build the backbone for primary healthcare system. And that will be the, major challenge ahead of us. And I am hoping that the government and our partners and we all are dedicated in coming days to build the polio legacy for our health service improvement.
And I'll just take you back to when you said that in 2015 we did not record any case, but unfortunately in 2016 in Borno State, Northeast Nigeria, there was a reported case. And I'm going to link this to access to rural communities. If we want to ensure that we do not have a resurgence, what measures are in place to ensure that we actually get real access to these communities, considering the fact that there are many communities now, the insecurity situation and all of that?
Insecurity is a major challenge, and we do accept that. So there are different strategies. One is that for the areas where there is no insecurity, we have a routine system in place, and there are health facilities, and around the health facility there is outreach services. But where there is no access or little access, and other than insecurity, there are areas we call hard to reach area where, is a difficult terrain and there are few settlements and the services are not there. So we have a hard to reach approach. So those hard to reach teams goes there once in a month with all the vaccines, with all the medical services. That is the Nigerian government through its state healthcare board and the SPHCDAs ensuring it. But in the inaccessible area, this is pretty tough to deliver vaccines and other services. But for example, in Borno, when it happens that when an inaccessible area liberated, then immediately the state teams, the vaccination team, and also the other humanitarian actors are reaching out there with campaign approach, with the services, so that those children are not ever immunized, so they are immunized, and other medical services can be provided on a we can say it's a mission mode, something like that. Hit and run, you just provide the service and return, and waiting for another opportunity so that you find a way to deliver those services. Right. So this is an evolving situation in the inaccessible area. There is no very specific way to reach out those inaccessible area, but it's depending on the evolving situation.
Thank you very much, Mr. Anis Siddiq. But we'll have you hold your thoughts here. We'll go just on a short break, and when we come back, we'll continue this discussion. All right, so thank you very much for staying with us. We're still discussing the great feat, Africa declared polio-free by the World Health Organization. And I still have on the program Mr. Anis Siddiq, who is the head of immunization for UNICEF Nigeria. Mr. Siddiq, thank you very much for staying with us on the program. As we were discussing earlier, now I'm just going to take you on the significance. We know that there's still Pakistan and Afghanistan battling with wild poliovirus. So what exactly is the significance of this achievement in Africa towards the eradication of wild poliovirus globally?
The polio elimination in Africa is a huge achievement, as I said earlier. And you see, if you see the global context, Africa was a major challenge, and which was now not a challenge in terms of polio eradication. But while the whole globe is not eliminating polio, for example, you mentioned Pakistan and Afghanistan. So we cannot say that polio is eradicated. So eradication is a term used when there is no polio virus in the globe. So since Pakistan and Afghanistan is having wild polio virus, we did not eradicate polio. So we eliminate polio from Africa. Now, think about a scenario where in the global scenario, Like the virus is not requiring any passport or visa to come to any country. And with this, all the movement, the virus may come anytime in Africa and infect any country in Africa. So this is very important that we follow the international health regulation that says that those pilgrimages are going out of Africa or out of Nigeria, they should have vaccinated against polio, where there's a common pilgrimage is taking place and you have the chance to be infected. And also to ensure that optimum level of vaccination coverage against polio in every country. In a worst case scenario, if there is a polio outbreak from other countries, so we can ensure safety for our children. And also it's important that the overall the achievement and success and the motivation to be generating around these other services so that our health workers are incentivized, not only monetary, but, this major feat which motivates them to do more for other diseases and, controlling and eliminating other diseases.
All right, so let's look at polio survivors now. I want to know, do you make use of them? Do you work with polio survivors in your maybe immunization campaigns, or so to sensitize people? Or what exactly is your plan, or what do you do with polio survivors? At least you work with them, you know them.
We have a partnership with the polio survivor groups. We, we tell them PSGs. They are very much part of our, strategy. So when a polio team goes in the field, we try to engage a polio survivors with a team so that it brings risk perception in the community, particularly where there is a substantial non-compliance for polio vaccine. We invite the polio survivor groups to be there and to tell their story, and that creates a huge change in the psyche of community. That look how polio can affect a human being, and being an adult or adolescent, they're using their aids, they're not able to do by their own. So those risk perception is giving a strong motivation within the community to accept polio vaccines. So since I joined UNICEF Nigeria in 2016, since then I have been seeing that the PSGs, the polio survivor groups, are very much involved with us, and they are supporting our program. And we are also benefiting from them. And it is really, really, a wonderful partnership. Knowing their difficulties, knowing their daily sufferings, they are still able to come out and help polio program.
That's indeed great. And lastly, before I let you go, Mr. Siddiq, what lessons do you think that we can learn from this, countries of the world can learn from this, particularly in Africa, as we're also fighting the coronavirus pandemic at this time?
Yeah, the lesson we learned is that one thing is that we say that we can achieve, we can beat any wild deadly virus. So we overcome the polio challenges, and of course this is a confidence that with the COVID situation, the emergency and the situation due to COVID, with some of the strategy we adopted in polio can be adapted for COVID, and then we can we see that we can get rid of COVID as well. The other lessons are that the partnership, the government alone cannot do, but without government, any partner cannot do anything. So the governments are in the driving seat, and partnering with government, that's the main course of action, and the leadership is very key in this fight against any disease, which we learn from polio. And also, I think this is a learning for the government as well. Like if the national government is spending enough resources and in a dedicated manner, we can achieve success. So what we achieve success around polio, the similar investment for COVID-19 in terms of financial as well as the human resource can achieve our goal. And last not but least, that the children should be in the cornerstone, in the forefront, and their health, their living is very important. That lesson we learned, that we need to save our children.
Right. Mr. Anis Siddiq, thank you very much for speaking to us on the program. And let me say well done and congratulations on this great achievement.
Thank you.
Oh, this is indeed a great one for Nigeria and the whole of Africa. And we can only hope, sincerely hope, that things speed up in Pakistan and Afghanistan as well, which are the last two countries with the wild polio virus. Well, on that note, we've come to the end of the program. Thank you very much for watching. I'll see you again next time.